Alzheimer's disease affects some 5 million Americans, and over the next 30 years, that number could triple, says Dr. Risa Sperling, a neurologist at Boston's Brigham and Women's Hospital.
I think Alzheimer's disease is an epidemic. It's a true health crisis because it's so expensive, both emotionally to families and certainly to our healthcare system.
But now, a tantalizing possibility. A way to potentially cut Alzheimer's disease off at the pass by early detection and treatment.
And just like every other disease where we've really made progress, we do it by detecting evidence of early disease before there are symptoms and before there's irreversible damage.
In the case of Alzheimer's disease, it's the early detection of what are known as amyloid plaques in the brain, using what's known as a PET scan.
Amyloid is a protein that our nerve cells produce normally, but in Alzheimer's disease it accumulates into these plaques, plaque buildup.
Sperling says that plaque buildup can begin decades before Alzheimer's symptoms show up, and therein lies the window of opportunity for treatment.
Alrighty.
Art Cantor, who scanned positive for amyloid buildup, is taking advantage of that window. The 67-year-old Boston resident is enrolled in what is known as the A4 study at Brigham and Women's Hospital. The study is testing whether a new drug, known as an anti-amyloid antibody, can clear plaques from the human brain.
It's worth it to participate. You know, I have nothing to lose other than the time I'm taking to do an infusion once a month.
Cantor has another good reason to participate. Alzheimer's can run in families, and his 92-year-old mother has the disease. More than 60 sites are participating in the A4 study across the United States and in Canada and Australia. When it's all wrapped up in 3 years' time, researchers hope to know whether halting Alzheimer's disease with drug therapy is possible. The monthly infusion is not the only thing Cantor is doing to try and hold off Alzheimer's. He exercises daily, eats a healthy, well-balanced diet. He exercises his brain, too, by engaging in projects such as his recent home renovation. And Cantor maintains a strong network of social connections. At present, he has no symptoms of Alzheimer's disease. Dr. Sperling is hoping to keep it that way.
The idea behind the A4 study is very similar to what we do in heart disease. We find people have slightly elevated cholesterol, and we decrease their cholesterol with statin drugs, and we hopefully prevent heart attacks or prevent strokes. I think we can do that in Alzheimer's disease if we start early enough and we have drugs that can safely lower amyloid and prevent memory loss.
In Boston, Jim Morelli for CNN.